Yeah. All right. So I'm Dr. Eric Heiliger. I'm the owner of the Care Health and Wellness Center. Since my last presentation, there's been a couple of new additions to the group. So I'll just give you a little bit of my personal history. I'm originally from the Bronx, New York, son of a school psychologist slash principal in the Bronx, and my mother was a retired stenographer. I'm the middle child with two brothers and a sister. Been married for 7 years now, and I have a 3-year-old son and a 1-year-old daughter. Okay, they are my driving force. Okay, so growing up, I was an honor student, and an athlete that was always hurt. I was always had some type of injury, and that's what kind of sparked my interest into learning more about the human body. I ended up going to the University of Maryland, where I studied kinesiological sciences. And while I was down there, I got an internship with Dr. Steve Horowitz, who was he was kind of like the celebrity chiropractor down there, and he worked with some Olympians. He worked with like the Washington Wizards and the Washington Redskins and some of the University of Maryland athletes. And so with him, he really kind of sparked my interest with chiropractic. So then I decided, once I graduated from Maryland, I went down to, I went up to UB, and I got into the chiropractic school there, graduated magna cum laude. And while I was working at University of Bridgeport, while I was going to school at University of Bridgeport, I worked with some of the athletes up there, some of the local, some of the local semi-pro teams, and some of the college athletes there. And then I was also working at the Stanford Hospital's the Tully Center. And actually, I know a lot of you guys from actually working at the Tully Center over the years. But while I was there in school, I ended up moving to Stanford and working with a local chiropractor here. And his specialty was kind of I'll just summarize it by saying he had a little bit of a different style of practice than I did. I kind of wanted to incorporate a lot of things. I was referring to a lot of acupuncturists, and it worked really well together. So then I decided to go back and get my certification in acupuncture. I also ended up going back and taking additional classes to get my diplomate from the American Academy of Medical Legal Professionals, which helps me in cases with trauma or car accidents and things like that to kind of certify me as an expert witness. Also throughout school, I was a certified strength and conditioning specialist, and that allows me to work with athletes. And so I still have a couple of professional athletes that I work with. I do work with some youth athletes as well, some youth elite athletes. And I'm also an anatomy and physiology professor for about 12 years now. For the last 4 of those, I'm at Norwalk Community College. Okay, so after working with the first chiropractor, I decided to go out on my own for after about 2 years, and I opened up Care Health and Wellness Center. And our approach is that we take a holistic approach where we look at the whole body. We evaluate everything from your posture to your nutrition, your fitness level, your daily routine, and we create a specific program for you. All right, so we incorporate everything from my background as far as your fitness and my background as a personal trainer, from acupuncture to chiropractic. We have massage therapists in the practice as well. And we take an integrative approach because we find that when multiple eyes are looking at a patient and we're looking at multiple from multiple backgrounds, we get the best outcomes for patients. Okay, so CARE stands for chiropractic, acupuncture, rehab, which includes physical therapy and exercise for personal training. But we also include we also have massage therapy. We offer spinal decompression therapy, naturopathic medicine, and weight management as well. So we are truly a one-stop shop for natural health care, and this is kind of what sets us apart from other health and wellness centers because we offer all these different modalities under one roof. So what would make an ideal patient, and how do you know if you need some of these services? If you wake up with stiff and achy joints, if you have numbness or tingling, dull spreading pain down an extremity, or headaches, tension and tightness, if you have hypersensitivity or burning pain, those are some of the signs that when someone is going to need either chiropractic or some of these other modalities. Now, what can cause some of these things? There's a lot of different things that can lead to these symptoms, mainly things like microtrauma, meaning things that build up over time, like poor posture, poor ergonomics. If people are, sitting at a like a dining room chair now that the pandemic has hit, and you don't have a proper chair or proper workstation set up, muscular imbalances, repetitive injuries, weak core muscles, things like that can lead to the need for care. Also, macro trauma, things like if you were playing sports and you blew out your knee, or if you were in an auto accident or slip and fall, or any type of improper lifting where you might have blew out a disc. These are types of things that are considered macro trauma that can lead to the need for care. So when someone is in pain, we offer a lot of different things that can help you, right? So if somebody's who's in acute pain and they can't, they don't really want to be touched, they don't want to be adjusted, or don't want to go through massage therapy because they want to be touched. So we have passive modalities that include things like acupuncture. Now, acupuncture, we use really thin needles that really gets deeper into the muscles, and it helps to relax the muscles, helps to increase blood flow, helps with pain management. So that's really good when somebody's really acute and they're in so much pain that they really can't tolerate some of the more aggressive treatments. We also have passive modalities like electrical muscle stimulation and ultrasound that also help to aid with the healing process. We also offer nutritional counseling and to provide the body what it needs to heal. Okay, so while you're going through the healing process, you need things to kind of help your body to heal itself. All right, so it can be things that are anti-inflammatory, things that can be joint supportive, like omega-3 fatty acids and glucosamine. So we have we do offer supplementation, and we have experts in the practice that can help you with that as well. Because while healing, if you look at this diagram here, when the muscle or tissue is healthy, it looks like this. But when it becomes strained, you can have partial tears, muscular damage, and nerve injuries and blood vessel tissue injuries. And if it doesn't heal properly, it'll start to scar over, and you'll develop scar tissue. So making sure it heals properly is going to be really important, because you don't want, after the healing process, your tissue to look like this third picture. So how do we correct these injuries with those services that we provide? But obviously, no two patients are going to be exactly the same. But in general, what we're going to do is we're going to work with a couple of different things. We're going to work with the tissue. We're going to work with the bones and the nervous system, work on correcting those postures, strengthen the muscles that are weak, stretching the muscles that are tight, correcting those improper ergonomics, strengthening the core, working on your flexibility, teach you proper bending and lifting habits, things along those lines. Okay, making sure that you maintain a healthy diet and stay active. Okay, we do have a rehab center within the facility to help you to strengthen and support those structures. Okay, and then once you're healed, we go through, you can work with us for personal training to allow you to remain healthy, and this way to prevent injury going forward. Okay.
2 minutes, Eric.
2 minutes, gotcha. Okay, so our care team right now, we've been going through some transitions because obviously there's not a lot of social distancing with when you're hands-on with patients. So, but we do still have a great team, including Dr. Sunny. A lot of you guys have met her before. She's come to the group a couple of times, but she's our naturopathic practitioner, and she does a lot of different modalities that helps with that uses the natural route. She's also our nutrition and supplement guru. Also, we have a massage therapist, Richard Dixon, who's works with also athletes, and he's also well known in the area. And these are some of the facilities, like our massage room, some of our spinal decompression tables, and treatment rooms, our rehab room, another treatment room, and some of the facilities that we use. And great referral sources would be primary care physicians, personal injury attorneys, nurses, orthopedists, neurologists, and things along those lines. So check us out on Instagram and Facebook. Give us a like, share us, and follow us. And if you have any questions, we can set up a one-on-one.